Their Royal Highnesses, and my greeting to Mrs. Winnie Biyanjima, UNAIDS Executive Director. My greeting also to Mr. Eamon Murphy, UNAIDS Regional Director for Asia and the Pacific. Excellency, ladies and gentlemen, respective representative from the Ministry of Public Health of Thailand. I have a great honor in this virtual regional meeting to briefly share our experiences from the HIV and AIDS response to contribute to the National Master Plan for COVID-19, and more importantly, to highlight how local, national, and community organizations brought their energy to come up with innovative approach to reach out and to mitigate socio-economic impact to the most vulnerable and marginalized groups. On HIV and AIDS, Cambodia is a country that has achieved epidemic control. We have a strong leadership, evidence-based services, and community engagement that have resulted with decline of new HIV infection by 62% and AIDS-related deaths by 54% between 2010 and 2019. The multi-sectoral HIV response model serves as a platform for the effective COVID-19 response, with community engagement in the center of it. In collaboration with network of PLHIV and key population and civil society organizations, UNAIDS has conducted two rapid surveys. First, with PLHIV, and second, with key population to get better understanding of community needs, the concern, and challenges during the COVID-19 pandemic. Follow-up action has been taken with key stakeholders to address the expressed need by PLHIV and key population to address some of the challenges posed by COVID-19. National AIDS Authority, in partnership with UNAIDS, conduct a HIV and social protection assessment to identify barriers that key population face in accessing social protection programs and health care services. NAA and UNAIDS have been working with key ministry and partners on follow-up action to address those identified barriers. Over the last several years, National AIDS Authority, in partnership with UNAIDS and UNDP, have worked with the Ministry of Planning to ensure inclusion of PLHIV and KP in poor household identification ID pool mechanism process, which is due to identify beneficiary for social protection schemes. This had led to improving ID pool coverage for PLHIV and key population, with 2009 and 10 PLHIV household received ID pool card in 2019. In context of COVID-19 response, an emergency cash transfer program was introduced as immediate social protection relief scheme to support poor and vulnerable population during COVID-19 pandemic. Existing ID pool, poor household identification mechanism, has been used to identify beneficiary of the program. Together with UNAIDS, NAA, that means National AIDS Authority, has successfully advocated for inclusion of PLHIV currently covered by ID pool scheme in the emergency of cash transfer program for COVID-19 response. This result in 2015 PLHIV household becoming beneficiary of the emergency cash transfer. Let me just underline that we spent around 20 million US dollar for this emergency cash transfer to provide support, financial support to the poor, including PLHIV in Cambodia. This urgent measure is currently being reviewed by the government and most probably will be extended for additional 6 months. I will stop my presentation now and I will be available for a question and response session. Thank you for your attention.